Okay, surgical pathology fellows. This part is a little bit of information that's focused to you. Let's see here. Okay, so subspecialties. You're going to rotate through 6 weeks of breast. These are split into 3-week blocks. 6 weeks of GI, GU, GYN, thoracic, 3 weeks of bone and soft tissue, 3 weeks of head and neck. It's going to be 2 to 3 weeks of neuropath and autopsy. Those are actually done 1 week at a time. 2 to 3 weeks of derm path. We'll discuss that more when you guys get here. And you get 3 weeks at least of frozen section pathology. So a typical day for the Surg Path fellows. The biopsies come out at 6 a.m. So depending on the service you're on and how many biopsies they tend to get, what time the attending wants to start signing out with you, you are going to come in time so that you can preview the biopsies, have the worksheet set up before you start your sign out. And so you can start that at 6 a.m. Usually sign out starts sometime between 8 or 9 a.m. Things are a little bit different with COVID, but we'll talk about that in person. As I mentioned before, at 11:30 a.m., you stop what you're doing so that you can attend your educational lecture. That goes for 1 hour. So then usually you have time to grab some lunch, follow up on cases from the morning, phone calls and emails that you need to attend to, or sometimes if you had not finished your sign out, you need to go back and finish your sign out, even though I don't think that that's going to be happening too much in this time of social distancing. Most of the subspecialty rotations have a consensus conference. There's a different schedule for each subspecialty. We will extend the Zoom conferences to all the fellows. So in case you have some downtime and you want to peek in on GU consensus conference, even though you're on the breast rotation, you can do that now that we're doing these through Zoom. So those conferences are usually around 2 p.m., but you'll see for whatever service you're on, the days and times that they have their conference. And then after consensus conference, the day is really sort of left to you to start previewing cases for the next day, going back to cases, following up on IHC, etc. In social distancing, there may be some attendings who don't sign out with you directly in the morning, but want to set up afternoon sessions where they'll go over the cases with you in a large multi-headed scope room so that you can be distant. And then there are cutoff times. So you're here on a Wednesday, you're done with your conferences, it's 4 o'clock, and the cases are coming out of the lab that need to be previewed. You are to preview all the cases that come out of the lab and from the accessioning, the DC cases, up until 7 p.m. 7 p.m., oops, sorry about that. 7 p.m. is our cutoff. So when you're on a frozen section rotation, it's 1 attending and 1 fellow. These are 1-week rotations. We have technicians for cutting and staining, but we will be teaching you how to use our machines to cut a frozen. But during normal working hours, you do not need to cut or stain the frozen sections. The technicians will do it. We're teaching you how to do it just in case it comes, a frozen were to come on a weekend or off hours. We'll talk about that when we go over call responsibility. So your main responsibility is to select the tissue that needs to be frozen, and then make sure that you select tissue for any ancillary studies that may need that maybe have been requested, photograph the specimen if necessary. If frozen section gets extremely busy, you can ask for assistance from the PAs. And especially at the beginning, if you're not sure how to handle a case, the best thing is to call the attending that you're working with. But if for some reason they weren't around or they weren't answering, you can check with the PAs because they know how all our specimens are grossed. So again, I keep repeating this, but even on frozen section, 11:30 is your educational conference. It's protected time. So you break and you go to your conference at 11:30. You grab some lunch between either while you eat it while you're at that educational conference, or you take a half hour after that conference to get something to eat. The attendings will cover frozen while you're gone. So coverage, this isn't officially in the schedule, but obviously it comes up. If somebody needs to be out, we need to change, something happens. It's rare that you'll need coverage in the gross room. It's possible that we'll need you to cover autopsies. Basically, it's covering your classmates, right? People are going to have to go for job or fellowship interviews. This year is unique because many of you still have not taken your board exams, and we're not even sure when those are occurring. So there are going to be days that people need to be away from the institution, and I may need to request that you cover each other. I'll say this to you again in person, but I'll just tell you now, it's a challenging year. And if you can get along as a class, understand that we are not judging you against one another. There's no reason for the surgical pathology fellows to be competitive with each other. If you're there and you're open and you're willing to help and everybody is putting in the same amount of effort, the year will go by so much better. If you're supportive to each other, the year will be so much better. Classes that get along really well, it just makes a big difference in their experience during the year. On-call responsibilities. So during the weeknights, Monday night through Thursday night, the person that's on neuropath autopsy carries the call pager. You carry that call pager all week because that's the pager that they will call you for an autopsy, but after hours, it's the pager that would be called for any issue that comes up. It is not common for us to get after hour pages. So the autopsy neuropath person carries that pager from Monday morning until Friday at 5 p.m. Or 4 p.m. Sorry, I wrote 4 p.m. here. Friday at 4 p.m., you pass that pager on to the person that's on call for the weekend. You're going to be on call approximately 3 times per year. You must remember to pick up the call pager from the neuropath autopsy fellow, whoever's on that time. If you're on a weekend where there's a holiday and it's a 3-day weekend, you are on for that 3rd day. So what your main responsibility on call really comes on the weekends and if there's an autopsy. You are responsible for off-hour frozen sections, but these are rare because we have attendings covering the ORs until the OR says they are complete. So the attendings stay here until however late at night to finish the frozen sections Monday through Friday. The ORs are open on Saturdays and there are Saturday frozens, but the fellows are not involved with that. There's an attending that is here and is supposed to stay here until the OR says they are done with frozens. If we get a call for a frozen section, I would say more commonly it actually comes from the derm team because they have somebody with a rash and they've done a biopsy and they need a frozen and a diagnosis. It is extremely, extremely rare. It has not happened in the past few years, but if a lot of people in the gross room were sick and out, we would potentially pull you in to help gross on a weekend. But again, that has not happened in several years. And that's it. That's it for your little bit of information and orientation for the Surg Path Fellows. Looking forward to seeing you guys. This is a lot of information and not enough information, but you know, we'll walk you through it all and it'll be a good year. Okay, see you soon.